The paper has been already been painted. Now you have to do the damage control.
But what do you mean by revision knee replacement?
If you have some kind of a complication, you always go through the complication. Out of 10 knee replacements, 5 will be diabetic. 99% knee replacement has a very good outcome all over the world.
So welcome to the program, doctor, and it's good to have you here.
Thank you.
So we're here today to talk about revision knee replacement. Chala mandiki we know what exactly knee replacement is, but what do you mean by revision knee replacement? It's an extra word added to it.
Yeah, as the word has a meaning, revision is revising. So when we come for a primary knee replacement is anybody with a basic arthritis, suffering with pain since many years, lowered functional demands. They go for a knee replacement. Now with any surgery, any kind of surgery, be it a knee replacement, be it any kind of a procedural on a body, has its complications happening around 5 to 6% all over the world. It's as per the evidence based. Now when it comes to primary knee replacement, it has its own set of complications occurring in anybody's hands, anywhere, any part of the world. Like in a primary knee replacement, there can be a chance of infection happening because of a urinary tract infection, or it can be because of lowered immunity status, or it can be because of comorbidities like diabetic condition not being controlled. So they can have a surgical site infection which can ruin the actual primary knee replacement prognosis. Or else it could be sometimes there can be a ligament issues arising in a primary knee replacement which could have been overlooked, or sometimes it could arise because of an implant wear and tear happening over there. Now in a revision knee replacement, why it has a separate guidelines, separate procedural guidelines, because you are not going in a virgin knee. It is already, you have the paper has been already been painted. Now you have to do the damage control.
So basically you are correcting or rectifying the primary knee replacement which have gone wrong from any
number of reasons. Any part of the bug, if a bug is in your body, first it will go to the foreign body only. So be it a valve replacement, be it the knee.
So talking about revision knee replacement or revision knee surgery, doctor, how different is this surgery when compared to the primary knee replacement surgery? I mean, do you remove the entire joint back again and correct it and replace it back?
Depends on the cause of why you're doing a revision knee replacement. Now, one of the causes is infection. That is the most common cause. If it is, as I told you, if infection is just a 3-week or 4-week-old, we retain as much implant as possible and just replace the polyethylene part. Now, if it is a chronic, as I told you, if it is more than 3 months or 6 months period, or it can be years sometimes in an Indian scenario, we first take out everything, take out all the implants, because implants are covered by a biofilm, which means that bacteria is lying on that implant. So we take out everything, take out all the non-viable tissue, and keep it as aseptic surrounding as possible, and put a cement spacer, antibiotic cement spacer, and wait for the infection to calm down, settle, and become a total aseptic surrounding in the knee. So you require a special implants for that, and you have to see what is the joint line level of it. You have to mimic as normal knee as possible with a specialized implants, and it has its own set of the template to follow. So in that way, revision knee is very much different from a primary knee.
So most of the patients coming back to you for a resurgery, or when the knee is not really that well. So I'm sure it must be traumatizing for them, because when you say that a repair or a surgery again. So how do you deal with this?
Now they come to the doctor to relief of the pain. We cannot beat around the bush and just keep giving antibiotics and hoping that infection will settle. Of course, our first measure of management would be give antibiotics and let's see. And we'll keep it on a good 3-day follow-up, see how the joint is behaving. So my boss used to say, like, if you have some kind of a complication, you always go through the complication rather than beating around the bush. So I believe in that.
that would prevent further
Further
complications.
infection. You either catch the nose from the front or back of the neck.
That's rightly said. So, are there any preventive measures that you think people could follow, especially after the primary replacement is done, to prevent this condition in particular?
So there are many sources of infection for a follow-up in a knee replacement. So what we tell to the patients is, keep your diabetic control to the max. Clean habits. Urinary tract infection ki anta clean habits unte anta clean habits. And second thing, avoid outside food, because you know it, outside food is a major source of infection. So minor corrections what humanly possible, మనం మానవంగా ఏదైతే చేయగలుగుతామో you can do it. Erstwhile you get an infection, anybody can catch a bug. So when you catch a bug, what you have to do is treat it early and go aggressively. Best way to control or patient to avoid these issues is have a good follow-up with your primary surgeon.
So, treating revision knee surgeries, doctor, are there any recent advancements if we have to talk about?
New evolution has occurred in part of implants, mainly the implants, and survivability of implants, and patient-specific implants have come up. So most of the time we want to go for less bone loss. There are many uncemented processes also have come. Previously it was only cemented. And the many companies are also coming up.
So discussing about treatment part, doctor, I'm sure for the patient it's not just undergoing the surgery, కానీ మెంటల్గా సైకలాజికల్గా చాలా బర్డెన్ కూడా ఉంటుంది. ఫస్ట్ క్వశ్చన్ వాళ్ళకి వచ్చేది ఏంటంటే నా ప్రైమరీ సర్జరీ ఏమైనా రాంగ్ అయిందా అని.
So that's very common. See, it can happen. Today I buy a car and car breaks down on the road. Hey, your company is. So it is common because that is the lack of communication or the knowledge patient doesn't have. Everybody does a surgery in a good intent. It's not that. But not all surgeries are 100% proof. 99% knee replacement has a very good outcome all over the world.
So before we wrap this episode, doctor, is there any message that you would like to share with our viewers out there?
So I would like to share that in a revision knee replacement or any primary knee replacement patient who has been suffering with any kind of pain or instability, na mokal anta control ledu, some kind of minor issues, or get it treated aggressively or get it shown to your primary surgeon as fast as possible. Don't neglect it. అంటే మనం దాని మీద వెయిట్ చేసే కొద్దీ ఉన్న ప్రాబ్లం చిన్న ప్రాబ్లం కూడా పెద్దది అవ్వచ్చు.
So thank you, Dr. Praful. It was wonderful interacting with you and our health talk show today.
Thank you, Lakshmi.
So this brings us to the end of this episode. Hope this episode was informative on the topic revision knee replacement surgery, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.